So hello everyone, welcome to my another video. So today we will be discussing about ATRACURIUM. So from the non-depolarizing muscle relaxant section of anesthesia pharmacology, ATRACURIUM falls in the intermediate acting class. So let's study about it. So ATRACURIUM is generally a bisquaternary benzyl isoquinoline non-depolarizing muscle relaxant. I repeat, ATRACURIUM is a bisquaternary benzyl isoquinoline non-depolarizing muscle relaxant. Its ED95 is about 0.2 mg per kg and the onset of action is about 3 to 5 minutes. The duration of action of ATRACURIUM is about 20 to 35 minutes. So I will repeat it for once again. Please listen it carefully. That ATRACURIUM is bisquaternary benzyl isoquinoline non-depolarizing muscle relaxant. Its ED95 is about 0.2 mg per kg. The onset of action is for 3 to 5 minutes and the duration of action is of 20 to 35 minutes. Let's look at the mechanism of action of ATRACURIUM. So the drug acts on both pre and post synaptic receptors. It produces the block by interfering with the passage of ions through the channels. So what happens here? So the ATRACURIUM acts both on the pre and post synaptic receptors and thus it produces the block by interfering with the passage of ions through the channels. So now let's look at the clearance of ATRACURIUM. So the drug ATRACURIUM neither follows hepatic clearance nor the renal clearance. It only follows Hoffman's elimination. So what is Hoffman's elimination actually? The non-enzymatic degradation by base catalyzed reaction at normal pH and normal temperature and also hydrolysis by non-specific esterases refers to Hoffman elimination. I repeat, Hoffman's elimination is the non-enzymatic degradation by base catalyzed reaction at normal temperature and normal pH and also the hydrolysis by non-specific esterases. So I hope it is clear now. Luadocaine is the metabolite in both. And since ATRACURIUM is not cleared by hepatic or renal metabolism, so it can be safely used in patients with renal or hepatic failures. Means ATRACURIUM doesn't follow the hepatic clearance or the renal clearance pathway. So it is just eliminated by the Hoffman's elimination procedure. And since it is not cleared by hepatic or renal metabolism, hence it can be used safely in patients with renal failure or in patients with deranged LFTs or some hepatic problems. I hope so it is clear that ATRACURIUM is one of the most safest drug to be used over here in case of patients with hepatic or renal failures. So please have a note of it. And I repeat for once again that luadocaine is the metabolite in both over here. That is in non-enzymatic degradation step as well as in the hydrolysis step. In both of these steps, luadocaine is the metabolite produced in the Hoffman's elimination process. Now comes the systemic effects. So in cardiovascular level, it increases the heart rate and it decreases the blood pressure. See, I have already mentioned it over here. Then in acid-basis changes, acidosis increases the duration of action of ATRACURIUM, whereas alkalosis decreases the duration of action of ATRACURIUM. I repeat, in case of acidosis, it will increase the duration of action of the drug ATRACURIUM, whereas in the case of alkalosis, it will decrease the duration of action of ATRACURIUM. There are no cumulative effects, there is no age-specific related issues, and hence ATRACURIUM is an ideal and safe muscle relaxant to be used. So this brings to the end of our topic of discussion, ATRACURIUM. I hope I was able to make the topic easier for you. And if you liked my video, please do share it. And if you are new to my channel, please do subscribe to my channel. So keep watching and keep learning.